Hello, my name's Dev Lall. I'm a general surgeon, and my guest today is Jeremy Latham. Hi, Jeremy. Can you hear me all right?
Hello, Dev. Hearing you loud and clear. Good to see you again.
And you, welcome aboard. Now, Jeremy is an consultant orthopedic surgeon, which means his field of expertise is treating problems of the bones and joints. But not only that, he's really drilled into focus now on problems that affect the hip joint. And so what I'd like to do is to talk to him a little bit about today about how he can help patients with hip problems. Jeremy, you've been looking after patients with problems with hip problems for a long time, is that right?
Yes, so I've been a hip surgeon for over 20 years now. I practice in Southampton. I was a consultant at Southampton General Hospital for 17 years, and I'm now fully in the private sector where I just do hips, hip replacements, hip resurfacing, and revision hip surgery.
With the whole COVID pandemic, of course, there's been a lot of obviously problems with infections there, but then people are very reluctant. There's a lot of fear about being seen for what somebody might assume is a non-urgent problem. I mean, is this something that you've seen in your experience?
A lot of my patients are in their 60s and 70s and even older sometimes, and they may well have other medical problems. So they might have been shielding during the lockdown. And of course, as they emerge from that, they're going to be very anxious about catching COVID because we're all concerned about it. But rest assured that the hospitals, now we're starting to see patients and get moving again. We've got very clear guidelines about how we manage this restarting of surgery. Everybody's screened before they come into the hospital. I have my temperature taken every time I go there. I have regular throat and nasal swabs to make sure I'm not carrying the virus, as do all the staff. And patients, of course, are on a very carefully constructed pathway of care to make sure, to minimize the risk of them bringing the virus into hospital, but also minimizing the risk of them catching it as well.
In many ways, that of course, because we understand that there are these potential risks there, it means we can, prepare for them and do something about it to minimize those risks.
Exactly that, Dev. And we're very lucky in the private sector because we are not admitting acutely unwell patients. We have that luxury of being able to select patients and carefully screen them so that the risk to them is minimized. But of course, we are feeling our way through this process. It's still early days in the restarting of elective planned surgery like this. And we all need to be very careful about how this proceeds. And of course, that's going to have an effect on waiting times, slowing down the pathways that we use in hospital to get people through quickly. Everything's just a little bit slower, but we hope that as long as things proceed in the way we hope they will, that by the end of the year, we'll be pretty much back up to speed again.
So if a patient were to, I don't know, drop you a note or pick up the phone and say, look, I'm worried about this, that, and the other. I'd really like to be seen, but I'm worried about coming in and to see your advice. I mean, seek your advice. What would you say to them, that they should come in or not?
Well, I'd say phone the office, speak to Anne and Tracy, and I can arrange a time to speak to you on the phone. So you don't have to come to the hospital. I can talk you through the part of the diagnosis that we need to make in order to see if you're a candidate for hip surgery. But most of that can be done over the phone. And if it seems to be the case that you're in that region of needing a hip replacement, I can bring you to the hospital, see you in clinic, get some x-rays, and we can make a plan based on that diagnosis.
So on that basis, if somebody is watching this thinks that they would benefit from seeing somebody like yourself, or maybe they've got a friend or relative who is struggling with hip problems, how would they best get in touch with you?
Best way of getting in touch, Dev, is to have a look at my website, www.lathamhipsurgery.co.uk. There's a mine of useful information there. If you sign up to the website, you will get some regular videos from me called Top Tips for Hips, which will talk you through the whole process of what osteoarthritis is, how to manage it, and what hip replacement surgery might be able to offer you. Have a look at that and then get in touch. Speak to the girls in the office, send me an email, and I can see you in clinic or speak to you on the phone, and we can start that process to help you get over your hip problem as quickly and safely as possible.
Thank you very much for your time today, Jeremy. I know you're a busy man, and certainly I found what you've had to say very reassuring, and I hope everyone else watching this has similarly found it helpful. Thank you, Jeremy.
Thanks so much, Dev. Good to talk to you again. Speak soon.